Okay, so today we're going to be looking at the effects of having that excess cortisol in Cushing's syndrome or Cushing's disease and the effects it has in the body. So let's go ahead and get started. And what I've drawn here is a liver. So one of the things you may recall is that you get an increase in cortisol when you're under stress, but in Cushing's syndrome and Cushing's disease, what happens is you get that increase in cortisol even though your body doesn't need it. So you're going to have it, right? You're going to have an excess of it. So here's what's going to happen. This is the liver. And basically what the liver is responsible for is one of the things it's responsible for is something called gluconeogenesis. So gluconeogenesis is the making of glucose from non-carbohydrate sources, such as amino acids and from lipids. So here's what's going to happen. We're going to get an increase when we have Cushing's syndrome. We're going to get an increase in this gluconeogenesis. And what's going to happen is, like I said, you get the increase in glucose in the blood, right? Now, normally this is going to go out to a cell and it's going to work in the cell. But here's what's going to happen in this case. Because we get this increase in glucose, what's going to happen is this is going to cause the pancreas to secrete more insulin. So now we're going to get an increase in insulin. And if you recall, insulin is responsible for taking this glucose and putting it into cells. Now what's going to happen, because we have this, over time we're going to build up a resistance. Your cells are going to build up a resistance to this insulin. So what's not going to happen then is this glucose is going to stay in the bloodstream. So because we have this glucose in the bloodstream now, we're going to get a condition called hyperglycemia. All right, hyperglycemia is excess glucose in the bloodstream. Then what's going to happen is eventually this is going to lead to type 2 diabetes. Okay, so there's one of the effects that you can get from Cushing's syndrome or Cushing's disease is we're going to have this excess glucose due to excess gluconeogenesis. So let's talk about this some more. So something else that's going to happen because we have gluconeogenesis is, like I said, your body uses non-carbohydrate sources to do this. So one of the things it's going to do is it's going to use lipids. And the breakdown of lipids is called lipolysis. Okay, so here we break down lipids. And they're broken down into fatty acids. Now, two things can happen here. One, some of these fatty acids are going to be used for this gluconeogenesis, but the other thing that's going to happen is this is going to start to be redistributed to other parts of the body. So basically you're going to take it from your arms and your legs, and it's going to be redistributed to other parts of the body. Sometimes it'll end up right between the shoulder blades, and the person will end up with what we call a buffalo hump. So you get a big old pad of fat right between the shoulder blades. Okay. The other thing that happens is sometimes it'll be around the face, and you'll get swelling of the face, and we call this a moon face. And then finally what's going to happen too is you're going to also get it around your abdominal area and around the trunk. We call this truncal obesity. So like I said, we're going to get the fat redistribution from the arms and legs around basically the axial part of the body, right? Between the shoulder blades, the face, and around the abdomen and that area, and truncal obesity. So that's one thing that's going to happen. So let's take a look also what goes along with this. And now we're going to look at proteolysis. So in gluconeogenesis, we also break down proteins. We also break down proteins to be used for gluconeogenesis. So here's what's going to happen here. We're going to get these proteins from muscle. We're going to get it from bone. And we're also going to get it from the skin. And here's what's going to happen. In the muscle, it's going to break the muscle down. And it's going to break it down to amino acids. It's basically going to break all of these proteins down into amino acids. And then again, those amino acids can be used for gluconeogenesis. So that's what's going to happen in muscle. With bone, there's collagen in bone. And I don't know if I mentioned this, but the most common protein is going to be collagen. In bone, it's going to break down the collagen in bone. That's going to lead to osteopenia and then eventually osteoporosis, right? And then the osteoporosis is eventually going to lead to fractures, right? So we're going to start to get fractures with this also. Finally, in the skin, what's going to happen is it's going to break down the collagen in the skin, and then the skin's going to start to tear, right? Where the protein's supposed to be. And this is going to lead to striations. Now, for lack of a better term, these striations basically look like stretch marks, but they're usually pink. Okay, so these are some of the characteristic signs that we're going to see with Cushing's disease and Cushing syndrome. Is we're going to get these striations, the moon phase, the truncal obesity, and the buffalo hump. So let's go ahead and take a look of how this is also going to affect the blood pressure and the cardiovascular system. Okay, so let's look at Cushing's syndrome or Cushing's disease effect on the cardiovascular system. So what we have right here is we have a blood vessel. So imagine blood goes through this. When someone has Cushing's, you have the receptors here. And what the cortisol will do is it'll make these receptors more sensitive to catecholamines. So catecholamines are things such as epinephrine or norepinephrine. When the catecholamines bind onto here, what it will do is it will decrease the size of the blood vessel. So if we decrease the size of the blood vessel, which we call vasoconstriction, what's going to happen is we decrease the volume. So if you remember from physics, if you decrease the volume, it's going to lead to an increase in pressure. And in this case, it's going to lead to an increase in blood pressure. So that's one way that Cushing's can affect the cardiovascular system. Down here we have a kidney. This is going to be another way. Cushing's can act like a mineral corticoid. If you recall, mineral corticoids are responsible for regulating the amount of water in the bloodstream to control blood pressure. So here's what's going to happen. We're interested in these parts right here. This is the distal convoluted tubule. This is the collecting duct. And remember, in the collecting duct, this is basically where your urine is, right? So my urine is basically going to be in here. What I've done is I've blown up one cell that's in here. Now, on these cells, now this could also be in the distal convoluted tubule, but on this cell, I'm going to put some channels. And these are what we call sodium-potassium channels. So what's going to happen is sodium is going to pass through these into the bloodstream when needed to regulate blood pressure, right? And it's going to go in there and it's going to regulate blood pressure. What happens in Cushing's is we get sodium going in there even when we don't need it to. So we're going to get that sodium going in. Now, what's going to happen over here is sodium is just going to go down this concentration gradient because this is going into the bloodstream. Sodium's going to pass into the cell. The big thing though is water goes where sodium goes, and this is why you get the increase in blood pressure. So water is going to come out of here and go into the cell, but it's going to continue to follow this sodium into the bloodstream. And so what happens is we start to get extra water in the bloodstream, right? Well, the heart has to pump all that extra water. So because the heart has to pump all that extra water, the amount of pressure or the amount of work the heart's doing is going to increase. So when we increase the amount of water, it is also going to lead to an increase in blood pressure. So we get an increase in water, the heart has to pump that extra water, which is going to increase the blood pressure. We also get a decrease in volume of the size of the blood vessel, which is going to increase the blood pressure also, because now the heart has to pump all that blood and excess water through smaller blood vessels, right? And like I said, if we decrease the volume, we increase the blood pressure. Now let's take a look of how Cushing's can cause a condition called hirsutism. So how does Cushing's cause hirsutism? Now this is only going to occur in Cushing's disease, not in Cushing's syndrome. So what's going to happen is this is looking on the brain of somebody facing that way. That's the cerebellum, the brainstem. This is the pituitary gland. So this is the posterior pituitary gland. This is the anterior pituitary gland. What's going to happen is you're going to get something called a pituitary adenoma. This is actually a microadenoma, right? So what's going to happen is, or if you recall, an adenoma is a tumor that's made up of glandular tissue. So in this case, we have the pituitary gland. We have a pituitary adenoma, which means this adenoma is made up of pituitary gland cells. This is going to cause a release of ACTH, even though we don't need the ACTH. The tumor is going to cause the release of ACTH. So what's going to happen is this ACTH is going to enter in the bloodstream and it's going to go to the adrenal gland. If you recall, the adrenal gland sits on top of the kidney. This ACTH comes down, and right now we're going to be concerned with this brown area in here. Now normally the ACTH is going to basically bind onto the zona fasciculata, which is that big green area, but we're not dealing with that right now. We want to deal with this zona reticularis, that brown area. So it's called the zona reticularis. And basically what the zona reticularis does is it secretes hormones called androgens. So now that we got this excess ACTH, we're going to get an increase in these androgens. Androgens basically give people manly features. So for men, though, we get most of our androgens, testosterone, from our testes. But in this case, we're going to get an increase in androgens. So in women, it's going to cause things such as excess hair growth. So they're going to get an increase in this excess hair growth all over the body. So it can be on the face, it can be on the back, the trunk. They'll get this excess hair growth. And this condition is called hirsutism. Okay, so let's take a look now of how Cushing's can affect the immune system. Okay, so how does Cushing's affect the immune system? So the first thing is this is a neutrophil, and so what's going to happen is when someone has Cushing's disease or Cushing's syndrome, they're going to get an increase in neutrophils. But the problem is that the neutrophils may not be able to leave the bloodstream and enter into areas where it can actually attack bacteria. So that's one way that's going to affect it. But the other thing it's going to do is it's going to decrease your B lymphocytes, and it's also going to decrease your T lymphocytes. And so because of this, the immune system is going to be weaker. So that's how it's going to affect your immune system. And really quick, the other thing it's going to do is it's also going to affect the brain. So how does it affect the brain? It can cause things such as cognitive problems, so people have trouble concentrating. It can cause depression. And another thing it can cause is anxiety. Okay, so that's it for Cushing's disease and Cushing's syndrome. Thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button, and we will catch you next time.